Cardiovascular disease. This is chapter 4. Cardiovascular disease is one of the leading causes of death of adults in Canada. Some of these deaths could be prevented if appropriate first aid was given. This chapter describes the first aid for cardiovascular emergencies, including first aid for angina, heart attack, first aid for stroke, TIA, first aid for cardiac arrest, which is CPR. High blood pressure. Blood pressure is the pressure of the blood against the inside walls of the blood vessels. Blood pressure goes up and down naturally. When a person is excited or emotionally stressed, blood pressure goes up, but it usually comes down once the excitement has passed. In some people, their blood pressure stays high all the time. This condition of constant high blood pressure is called hypertension. Over time, hypertension damages the tissues of the cardiovascular system. The walls of the blood vessels become thick and lose their elasticity, and the heart becomes enlarged. The changes caused by high blood pressure increase the risk of stroke, heart attack, kidney and eye problems. Unfortunately, hypertension does not always give warning signals. You may feel perfectly well, but still have high blood pressure. This is why it's often called the silent killer. If you have concerns about your blood pressure, you should speak with your primary healthcare provider. Blood pressure machines located in pharmacies can help you monitor your blood pressure, but should never be used as a means of self-diagnosis. Narrowing of the arteries. Arteries are the blood vessels that carry blood away from the heart. They become diseased when fatty deposits build up inside them, making the passage for blood narrower. This process of depositing fat and narrowing of the arteries is called atherosclerosis. No, let me say that again. Atherosclerosis. Atherosclerosis. In the coronary arteries, which carry oxygenated blood to the heart, it's called coronary artery disease. As the artery gets narrower, less and less blood can go through. When the artery gets too narrow, the tissues on the other side of the narrowing don't get enough oxygenated blood to function normally. Although the signs and symptoms of hardening of the arteries usually does not appear until middle age or later, atherosclerosis often begins in childhood. Angina. Angina occurs when the blood supply feeding the heart muscle becomes limited due to narrowed, damaged, or blocked arteries. When the heart works harder and needs more blood, for example, when you run for the bus or shovel snow, it cannot get enough blood. This causes pain or discomfort in the chest, which may spread to the neck, jaw, shoulders, or arms. Angina pain typically doesn't last long and goes away if the person rests and takes their prescribed medication. Heart attack. A heart attack happens when the heart muscle tissue dies because its supply of blood has been cut off. A heart attack can feel just like angina, except the pain doesn't go away with rest and medication. If the heart attack damages the heart's electrical system, or if a lot of the heart muscle is affected, the heart may stop beating properly. This is called cardiac arrest. Risk factors. A number of factors increase the risks of cardiovascular disease, for heart attack and stroke. These can be broken down into modifiable and non-modifiable risks. The modifiable risk factors can lead to dyslipidemia, which is increased deposits of fats. It can also lead to obesity, diabetes, and high blood pressure. Non-modifiable risks are age, genetic history, and your sex or gender. Modifiable risks include smoking, poor diet, lack of exercise, increased stress. Modifiable risks can be reduced through lifestyle changes. Angina and heart attack. Early recognition and denial. The first step is recognizing a cardiovascular emergency. It's difficult to accept that someone is having a heart attack and could die very soon, especially if the person is a close family member or friend. The casualty is often denying anything serious is happening as well, so it's easy to accept their reassurances. On average, casualties take several hours to get from the hospital to the hospital from the time that they start feeling poorly. It is this wasted time that prevents many lives from being saved. When someone complains of chest pain, shortness of breath, and looks odd, you should consider it a serious problem. That's early recognition and call for medical help. Getting the casualty to the hospital quickly gives them the best chance for survival. Chain of survival. CPR is often what comes to mind when people think of first aid for a heart attack or cardiac arrest. But CPR is only part of the picture. There are 5 steps that are important when helping someone with heart problems. Number 1, immediate recognition of a cardiovascular emergency and activation of the community emergency medical system or medical services, what they call EMS. This means calling for help quickly. Early CPR with an emphasis on chest compressions is number 2. Number 3, rapid defibrillation. Number 4, effective advanced life support. Number 5, integrated post-cardiac arrest care. Each of these steps is as important as the others. Time is the vital ingredient. To give a casualty in cardiac arrest a reasonable chance of survival, CPR must be started immediately, followed by defibrillation as quickly as possible. For both procedures, The sooner they happen, the better. You, the person trained on the scene, are responsible for initiating the sequence. You must recognize the cardiovascular emergency, call for medical help, start CPR if needed, and apply a defibrillator if one is available. You are the crucial first 3 links in the chain of survival. If nothing is wrong, the ambulance crew can reassure the casualty. On the other hand, if there is a serious problem, you may have saved a life. Signs and symptoms of angina and a heart attack. A heart attack will produce shock and may display some of the following: pale, ashen skin, sweating, cold and clammy to the touch, shortness of breath, showing obvious pain or discomfort. The pain or discomfort will be in the upper body, from the upper abdomen to the jaw and arms, and may feel like heaviness in the chest, tightness or pressure in the chest, squeezing or crushing chest, indigestion, nausea or vomiting, an aching jaw, or sore shoulders or arms. Some of the signs and symptoms include, let me see, wait just 1 second. Yeah. Okay, some of the signs and symptoms include fatigue, anxiety, which produces denial, central back pain. Denial is an important detail. If someone is showing signs of shock, having trouble breathing, and experiencing pain, they insist there's nothing wrong, you should be very suspicious and take action. First aid for angina or heart attack. Number 1, perform a scene survey. Then do a primary survey. Ask the casualty questions. Can you show me where it hurts? Have you had this pain before? Do you have medication for this pain? Number 2, call for medical help and get a defibrillator. Number 3, place the casualty at rest. The semi-sitting position is usually the best option, and reassure them. Number 4, assist the conscious casualty to take their prescribed medication, usually nitroglycerin. If the casualty has no prescribed medication, or the first dose is ineffective, ask the casualty if they have any allergies to ASA, which is aspirin, or if a doctor has ever told them not to take it. If the casualty believes they can take it, suggest they chew 1 regular ASA tablet or 2 low-dose tablets. ASA, which is acetylsalicylic acid, can reduce the effects of a heart attack because of its anti-clotting properties. And number 5, if the casualty loses consciousness and stops breathing, start CPR. Helping with nitroglycerin. Nitroglycerin tablets or sprays are common medications for relief of chronic angina pain. A casualty is in serious distress may need your help to take their medication. Ask the casualty if they've taken any other medications today. Drugs to treat erectile dysfunction, such as Viagra or Cialis, may cause a significant decrease in the person's blood pressure if nitroglycerin is taken as well. Have the casualty spray the medication under the tongue or place the tablets under the tongue. They are not to be swallowed. Nitroglycerin may be repeated, if needed, every 5 to 10 minutes to relieve pain, or until a maximum of 3 doses has been taken. Remember that if you have to assist someone to take their medication, you must call for medical help.